Good morning, I am Angela Misi Panganiban, and today I am going to do a return demonstration on applying and removing PPE or personal protective equipment. And the first step that I'm going to do is introduce myself to the client and verify the client's identity. And for example, ma'am, I am Angela Misi Panganiban, and today I am going to be the student nurse. May I know your name po? And this is done because we want to ensure that the client is the right patient, and in order to deliver the right procedure or to deliver the person to the right place. And the next step that we're going to do is explain the procedure to the client. Why are we doing this? This is to ensure that the client knows what you are going to do and why is it done. For example, ma'am, I'm going to assist you po in the delivery room or the operating room, and I'm going to wear protective equipment so that we can ensure your safety and my safety as well, so that there will be no casualties or incidents. And the next step that we're going to do is gather all the necessary or appropriate equipments. Bakit natin ito ginagawa? Kinukuha na natin yung mga appropriate na gamit para hindi tayo magsayang ng oras, because time is of course important, and that we don't waste the time that is needed. And the next step I'm going to do is perform hand hygiene. Why are we doing hand hygiene? This is to ensure that there will be no bacteria, or that we can eliminate all the bacteria on the equipment and on the clients. The next step that I'm going to do is apply clean gown. And in applying clean gown, hold the neck part or in the upper part of the gown. Like this. By holding the upper part of the clean gown, insert your arms. And after that, we hold the lines or the strings and tie it up close. And I'm going to turn so that you can listen to the camera. As you can see, I am having a hard time on putting the PPE since it is big on me. And make sure in acquiring a PPE, you have the right size so that there will be no microorganism that can enter in the space. But since this is what I have available, we will make do with it. The next step that I'm going to do is apply face mask. Since this is the only available face mask and not the surgical mask, we will do with it. Make sure to put it in your ear at the back and pinch it here so that there will be no space. The next step that we're going to do, and the reason why we put the gown is to protect our skin from the bacteria that can splatter, and as well as the face mask since we can inhale any aerosol bacteria in the air. And the next step that we're going to do is wear the eyewear, just like wearing eyeglasses. And this is to ensure that there will be no splattering of the blood, bacteria, or anything, or any foreign or particles that can get on our eyes. The next step that we're going to do is apply clean gloves. With your hands, pinch it here, and then wear it. I am using a latex or latex glove, and this is appropriate because this is gives sensation to the skin, more sensation, you can feel more. And next, we're going to, as it was not finished, we're going to hold the next one. Hold it. Hold your hands like this. And enter your hands. Wear it. Why do we wear gloves? This is to ensure that there will be no bacteria as well, even though it is repeating. This is to ensure that there will be no viruses or microorganisms. Make sure that it is enclosed so that there will be no area that is not seen or can enter. The next step that I'm going to do is when removing the sold PPE or the PPE that is used, you need to remove the gloves first. Why do we remove, and how do we remove the glove first? We use it in one hand like this. And hold the inside. Bakit hawakan yung inside? Kasi ito yung clean part in loob. Because the infected or the soiled part is the outer part. And as you can see, I only have one gloves at hand and dispose it properly. The next step that I'm going to do is perform hand hygiene. This is to ensure that there will be no bacteria as well, as we just finished, or as we are just removing the soiled material. And remove the eyewear, hold it here, and dispose it appropriately. And then remove the gown. Remove the gown and preparing to leave the room. And make sure that the gown is removed from inside. Hold it on the inside part, since this is the one that is not infected, and remove it. And you can see that I am holding the inner part while removing it. And hold it here. And dispose it properly. And next that we're going to remove is the mask. Hold it at the back, like this, and remove it like this, and dispose it appropriately. Dispose the PPE equipment appropriately. And after that, the reason why we're disposing properly, because as it is contaminated or infected, the outer part, we need to ensure that it is not gonna be spread, especially, and the reason why we remove the gown when preparing to leave the room is because we don't want the bacteria to go outside of the room, as it can infect other people. The next step that I'm going to do is perform hand washing or perform hand hygiene. Again, this is to ensure that there is no bacteria left or any microorganism. And the next step that I'm going to do is, or the next procedure is, use proper body mechanics throughout the procedure. And lastly, communicate appropriately with the client, since this is for the client. That's why we're doing this. This is to provide patient care. So that's all. Thank you.